Now to talk about COVID-19 with one of Boston's top infectious disease doctors, Dr. Shira Doron, an epidemiologist at Tufts Medical Center. Thanks as always for joining us.
Good to be here.
So Dr. Doron, today Governor Baker said the state has now conducted more than 2 million COVID-19 tests. They continue to expand their Stop the Spread program, adding 3 more testing sites in the state. Are we where we need to be on testing, especially considering the potential of a second surge?
Well, free testing sites definitely get us closer, but we need to be at a place where anyone with symptoms can get a test without a long wait and with a reasonably fast turnaround time to those results, and where we're doing testing on people without symptoms in a coordinated and strategic fashion. So we still have some work to do there.
Yeah, okay. Meantime, a lot of talk about back to school. Obviously, the governor also saying today that about 70% of districts are going to be offering some type of hybrid plan or full in-person school at this point. 30% want full remote. And parents do have a lot of choice in this. They can opt for remote in many cases. What should parents be considering when they're trying to figure out whether or not to even send their kids to school?
Well, overall in Massachusetts, we're in a very good place as far as case numbers to support a safe return to school. But the state has actually gone a step further. They're now giving us those metrics by town. And so particularly if you have a child with underlying medical conditions or someone who's vulnerable at home, you can now look at the statistics for your own town and know if it's in that white, yellow, green, or red category, which is determined by cases per 100,000. But ultimately, there's no right or wrong answer, and each family needs to determine how they feel about the risks versus the benefits of in-person school.
Okay, and to see that information you spoke about, the website mass.gov/COVID-map. And before you go, an official with the World Health Organization said the epidemic is changing, and we've been hearing this for some time. Younger people in their 20s, 30s, 40s who are asymptomatic, don't know they're infected, they're spreading the virus. Have you seen evidence of that happening here as well in Massachusetts and Boston?
I think that's probably a fair assessment. If you look at the data from Massachusetts in the last 2 weeks, the rate of cases is higher in that 20 to 50-year-old, those groups in that range, than the older age groups. And some of that might be our increased testing of asymptomatic individuals, especially the testing that we're now doing before and after travel, and the fact that our older residents have become more careful about their movements. But we've also, of course, heard about a number of these super spreader events, large gatherings involving young people this summer. So it's entirely possible that a lot of the transmission today is being driven by those younger age groups.
Okay, well, we all have a responsibility to make sure that we're abiding by the guidelines. Dr. Doron, thanks as always for joining us.